Anyone who's ever been a child, or had one, knows that feeling, right? The sterile smell, the super bright lights, the sight of a needle. For a kid, a doctor's office can feel like the absolute scariest place on earth. And for decades, healthcare kind of struggled with this, often causing just as much fear as it was trying to cure. Today, we're going to dive into the revolution that changed all of that. A huge shift in thinking that finally put the child and their family front and center.
And really, everything we're about to talk about boils down to this one single, powerful idea from a foundational textbook. Now, it seems pretty obvious, doesn't it? But really, truly internalizing this concept that kids aren't just scaled-down adults, well, it fundamentally changes every single thing about how we approach their medical care.
So here's our game plan. First, we'll look at that old small adults problem. Then, we'll get into the huge shift to what's called family-centered and traumatic care. And finally, we'll see how some pretty simple changes in communication and partnership lead to way better healthcare.
All right, first things first, let's really get a handle on the problem that pediatric nursing set out to solve. The traditional way of doing things was often built around efficiency and just, getting the procedure done. But it frequently overlooked the most important person in the room, the child.
I mean, think about it. In that old model, a child's fear was basically seen as an obstacle to get past, not a totally valid response that needed to be addressed. Parents were often told to wait outside, which took away the child's #1 source of comfort. This just created this vicious cycle of anxiety and trauma that can make every future medical visit even harder, and could even shape a person's relationship with healthcare for their entire life.
But then, a really profound shift started to happen. Healthcare pros started asking, hey, what if we design care around the family, instead of always asking the family to just fit into our system? And that question led to this whole new philosophy of family-centered care.
And this is where the perspective completely flips. Doctors, nurses, specialists, they come and go. But what's the one constant in a child's life? It's their family. Family-centered care puts them right at the heart of the whole process. It's a huge move from just treating a disease to caring for a whole child within their family unit.
These principles are pretty much the pillars of that whole philosophy. Recognizing the family as the constant. That's step one. But look at the others. Collaboration and sharing unbiased information. That means no more talking over parents' heads. It means treating them like the experts they are on their own child, which, guess what, leads to better information, faster diagnoses, and just plain safer care. It redefines everyone's role for a much better outcome.
So you have this great new philosophy. But what does it actually look like in the real world? Well, if family-centered care is the what, then atraumatic care is the how. It's basically a commitment to providing top-notch care without causing all that unnecessary physical or psychological stress. Ah, yes, the classic challenge, right? It's a procedure that's absolutely necessary, but is almost guaranteed to cause fear and pain. Well, the principles of atraumatic care give us a clear and, frankly, much more compassionate answer.
And wow, the difference here is just night and day. The old way was all about just getting it done, often using force and surprise. Atrauma care, on the other hand, prioritizes the child's well-being. So instead of holding them down, you give honest explanations. Instead of surprise, you offer choices. Hey, which arm do you want the shot in? Which gives them a little bit of control. And crucially, parents are brought in as partners in comfort, not kicked out to the waiting room.
One of the most powerful tools for this kind of care is also one of the simplest: communication. A great pediatric nurse basically becomes a translator, turning the strange, kind of scary world of medicine into something the child can actually understand and cope with. Now, these aren't just cute little tricks. They are actually really sophisticated psychological techniques. Letting a kid hold a stethoscope before you use it makes it less scary. Talking to their teddy bear first shows them exactly what's going to happen in a totally non-threatening way. Every one of these steps is all about building trust and empowering the child, turning them from just a passive patient into an active participant. Okay, this right here might be one of the most powerful tools in the entire toolkit. Seriously, let's break down this simple sentence. You feel unhappy. That validates their emotion. It tells them, hey, what you're feeling is real and it's okay. And the because part, that shows you get why they feel that way. It builds this amazing bridge of empathy. It is the polar opposite of saying, don't cry, or it's not that bad. And all of this leads us to the final, absolutely essential piece of the puzzle. The ultimate expression of family-centered care is when parents are no longer seen as just visitors, but as vital, crucial members of the healthcare team.
Just look at how this partnership works. For a child to feel informed, the parent asks questions and the nurse clarifies and teaches. For comfort, the parent provides that familiar, safe presence, while the nurse handles the clinical side of things. For decisions, the parent advocates and the nurse provides the options. You see? It creates a complete support system with the child right there in the center.
And this brings us to the most important takeaway of all. This entire approach, it isn't just about being nicer. It's about being more effective. It's just better medicine. A child who is less anxious is way more cooperative. A parent who is treated like a partner provides better information. And all of this leads to fewer complications, better results, and ultimately, better health for the child, both right now and for the rest of their lives.
So, we'll leave you with this thought to chew on. These principles have totally revolutionized care for children by seeing them as unique people and by empowering their families. But what if we applied that same philosophy everywhere? To taking care of our elders, to managing chronic diseases, to every single corner of medicine. Just imagine what we could achieve if we always treated the family not as an inconvenience, but as our most valuable partner.